Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Public Health on Call's first episode was released on March 3rd, 2020, when there were 1,922 documented cases of COVID-19 around the world, with just 21 known cases in the United States. 1 year later, more than 28 million people have tested positive in the U.S. The pandemic has killed nearly 500,000 Americans and more than 2.4 million people around the world. In over 260 episodes, we've brought evidence and experts to help unpack the day's COVID-19 and other public health news. This podcast has been downloaded over 4 million times in the last year, thanks to listeners like you. In recognition of the 1-year anniversary of the podcast, Public Health on Call is going live. In addition to our regular episodes, you can join us for a live episode at 11 a.m. every morning, starting Monday, March 1st through Friday, March 5th on the Johns Hopkins Bloomberg School of Public Health's Facebook page. We'll be talking to national leaders and experts on COVID vaccines, health equity, and mental health, and hearing from a top public health official about the state of the battle against the pandemic. We'll also be taking your questions from the comments for a special finale Q&A on Friday, March 5th. You can learn more about the full lineup at Johns Hopkins SPH on Facebook, and be sure to tune in live for the first session on Monday, March 1st at 11 a.m. Hi, I'm Lindsay Smith-Rogers, the producer of Public Health on Call. Today, Colleen Barry, chair of the Department of Health Policy and Management, talks with Mark Hetherington, a professor of political science, and Jonathan Weiler, a professor of global studies, both from the University of North Carolina. They discuss the concept of worldview and why it matters for understanding the politics of COVID-19. Let's listen.
Mark Hetherington and Jonathan Weiler, thank you both so much for joining me today. You've written a number of books together about political worldview. In your most recent book, Prius or Pickup: How the Answer to 4 Simple Questions Explain America's Great Divide, is particularly important for thinking about the politics of COVID-19. Jonathan, let's start with you. Can you first describe for our listeners what you mean by worldview?
Colleen, thanks so much for having us. So when political scientists talk about ideology, they talk about a connected set of ideas that help people think about their political attitudes about whether it's the size of government or other issues that are on the political agenda. So when we talk about worldview, we're talking about something more sort of fundamental and really prior to ideology, really a kind of gut level set of instincts and ideas about right and wrong, what's safe and what's scary, what's familiar and what's sort of alien. And so our interest in worldview really is in the degree to which those very fundamental orientations that precede politics have come to have such a powerful influence on our political attitudes. And I'll just add that what we think is so significant about the evolution of American politics over the last 20 to 30 years is the degree to which those underlying worldviews have become such important parts of the bases. Distinct worldviews have become such important parts of the bases of the Democratic and Republican parties in ways that have made Democrats and Republicans not just disagree on issues or ideas, but on much more fundamental questions about how people should be in the world.
Okay, Mark, let's pull you into this conversation. And I want to put this concept of worldview in the context of COVID. What do we know, or what might we hypothesize about how a person's worldview could influence their thinking about COVID generally and about specific things like wearing masks?
And again, thank you, Colleen, for having us on the show. Two things that I think are really important. The first part is not as directly related to worldview as the other. So the first thing is what has happened in American politics as our worldviews have been connected to our partisanship is that it's kind of like supercharged our partisanship. It's become, much more of an important part of Americans' identities about themselves, their political leanings. And as a result, it seems to have caused partisan followers in the electorate to be much more likely to follow their partisan leaders in government in a way that, always happened, but it's now a process that's like 2 or 3 or 4 times more strong than it was, back in the 1980s before this sort of worldview evolution took place. So, what we're doing now more is following our leaders, which is fine unless they set a bad example, in which case it can be a public health disaster, as has happened with COVID. So that's, the first thing. We find these massive differences between Republicans and Democrats in their following, again, bad examples of their leaders relative to Democrats following relatively good examples of their leaders. This partisan gulf in COVID mitigation approach didn't have to exist, okay? But it does because of this, more highly partisan political system. Okay, now the second thing is the notion of how a worldview might affect, say, people's willingness to do the things that are necessary, like wear a mask, stay 6 feet apart, stay home. And, what we've done over the last number of years is identify these other parts of people's worldviews, how incremental they want the world to change, how competitive they are about the world, and so forth. And, these are, as Jonathan was pointing out, natural parts of how people approach life. And so, these are things that, generally people don't really, have a lot of control over. They're just natural. And so certain people are going to have a harder time making changes or thinking that changes are necessary. So we find, these various aspects of people's worldview, the degree to which they, are okay with change taking place, the degree to which they think the world is, something to compete as opposed to something to cooperate, and so forth, have a huge impact on what people are doing in the world.
So let's take this back to sort of really making sure listeners understand the core concept of what worldview is. So Jonathan, can you say a bit more about how you measure worldview? How do you determine what kind of worldview I have or someone else has? And what are these 4 simple questions your book makes reference to?
Yes, so when we talk about worldview, we're talking about, as we said, these very fundamental orientations to how people think about their place in the world. And the way that we didn't come up with these questions, but political scientists and other social scientists have been thinking about the difference between people who are more authority-minded and people who are less authority-minded over the last several decades is by asking basic questions about what people think it's most important for children to be raised to believe, right? So, for example, people are asked, do they think it's more important for children to be independent or respect their elders, for them to be curious or to have good manners, to be self-reliant or obedient, for example? And just a quick note, Colleen, is when people hear a lot of these attributes, like curiosity versus good manners, they often think, well, both are important. Right, but when we force people to make a choice, it's the prioritization that turns out to be incredibly revealing about people's worldview. And in recent decades, that has translated into a very clear understanding of how they align themselves politically, whether they're Democrats or Republicans. One other thing to say is I mentioned authority-minded versus non-authority-minded, and as Mark just pointed out, what we've seen among Republicans in particular, who we've historically associated with authoritarianism or authoritarian-minded worldviews, is that they're the ones who have tended to defy certainly public health authorities and to refuse to cooperate with them. And I think this is an important part of what Mark is talking about, trying to appreciate a more sort of multifaceted and nuanced and contextual way of thinking about worldview, so that people who are authority-minded in general may say, screw you to public health authorities if the leaders they follow, as Mark described, tell them to.
So people can have fixed worldviews, they can have fluid worldviews or mixed worldviews. And these worldviews derive from our childhood or the child rearing approaches that are sort of basic to who we are as individuals, it sounds like you're saying. And they're connected to, but differentiated from our partisan affiliations. That is what makes us Republicans or Democrats or independents. Is that right?
Yeah, that's right. And just one more point here. Look, there's always been differences. People have always had differences in our orientation to the world, in worldviews, in the way that we describe them. They have not always so clearly anchored and differentiated Democrats from Republicans. That's a process that's unfolded over the last generation or so. And it's that sorting process, as we and other political scientists describe it, whereby those with a more fluid worldview have become Democrats more reliably, and those with a fixed worldview have become Republicans more reliably, that have lent this new, much more emotional, gut level, and instinctive character to how we think about politics.
So as our political identities have gotten more polarized over time, is it fair to say that that's same thing is true of our worldviews, that our worldviews have become sort of stickier and more fixed over time?
Well, I don't know that that is the best way to think about it, actually, Colleen. I think the key thing is about worldviews is we have them, and this is the thing that makes them so powerful, because we grew up, developing them. These are the building blocks that our parents passed along to us, our communities passed along to us. Slow and steady wins the race. You follow directions or, you get in trouble. And then, the thing that happened was politics evolved in a way where all of a sudden those life lessons really started to connect to politics in a way that they didn't used to. So how authority-minded or independent-minded our worldviews were, they didn't really tell us very much about how big government ought to be. That's what the old, divide in American politics used to be. The Republicans were, small government, Democrats were big government, but obedience and, or independence doesn't tell us about that. But as politics evolved to, bring in, racial issues and gender issues and sexual orientation issues and immigration issues and things like that, our understanding about politics became informed by the worldviews that we brought to the table. And, because those matter to us in a really intense way, our worldviews, we really believe these things. That's what creates this sort of, partisan edge. A little more government back in the old days, a little less government, who cares? But, when it comes to, whether the world should be more, hierarchical or horizontal, those are things we care about.
And if I could just add one thing, Colleen, to what Mark just said, and part of what this means is that even our very mundane and formerly or notionally non-political choices become markers of our politics in ways that people can readily identify. So, for example, whether I prefer Starbucks to Dunkin' Donuts, maybe that wouldn't have mattered to anybody in a previous era. It's just a difference in taste. Now it's much more likely that somebody will make the connection, oh, Starbucks, you must be a liberal. Or Dunkin' Donuts, you must be something else. And so we don't have to be talking about politics any longer for people to make very clear political judgments about who we are. And so that means that kind of intensity and acrimony, it suffuses all walks of life in a way that we would argue is not previously true.
And you can see how this fits into COVID too, how all of these different things become symbols of the opposite sides of the divide. So on the more conservative side of the divide is, sort of this toughness, this strength, this unwillingness to bend versus the snowflake softness. And the mask becomes the embodiment of that on one level or another. Where even, the American president, Donald Trump, is deriding Joe Biden for how ridiculous he looks in his mask. I mean, that's almost unthinkable when you imagine what American politics might have been like when, Harry Truman was running against Thomas Dewey in 1948. This is, and COVID fits just so neatly into this divide.
So setting aside the pandemic for just a moment, I want to come back to it. How might worldview influence our thinking about other serious public health issues, Jonathan, like climate change or immigrant health? Draw the thread for us to some of these other public health challenges.
Well, it's a really good question, Colleen, and I do think this is where context matters. And so, for example, when it comes to climate change, in other parts of the world, this worldview divide that we are describing is very salient in places like Britain and France and Germany, for example. And immigration has become an incredibly contentious issue really across all of those societies. And I think that worldview does explain very well, and I think in ways that would be obvious to your listeners, who would be more sort of comfortable with more immigration and who would be less so. But climate change is interesting because in other places, opposition to climate change is not the same as it is here. Conservative or right-wing parties in other parts of the world, there are some, but most are not climate change deniers in the way that's become common in the United States. And I mention that example because in this case, it's not just worldview. It's a particular way that that Republican elites in the United States have positioned themselves relative to that issue that then, and this goes back to a point Mark was making earlier, signals to their base, to their adherents, that part of what it means to identify as a Republican is to say that climate change, it's overstated as a problem, and really you're just trying to intrude in our lives and get government to tell us what to do.
That's great and really helpful. Mark, I want to circle back to this, the basic point that we're in this incredibly polarized period. And then COVID is layered on top of an extreme polarization of our political process. How does worldview help us think about what the legacy of the Trump presidency will be as we move forward?
Oh, that's such a great question. The thing that I can't help but wonder, and it dovetails with what Jonathan was just talking about relative to climate change. I don't know that there's necessarily all that much about our worldview specifically that would have caused conservative Americans to fight against COVID mitigation strategies. What we show in our public opinion data at the very beginning of things in April, that partisanship had no impact on people's attitudes and behaviors because both sides, both Republicans and Democrats at that point were sending the right signals. We needed to shut down. We needed to do all of these different things. And public opinion reflected that. And my belief is that it probably would have continued to do that had people on the political right continued to send those messages. We would have seen, some slight differences. But what President Trump did by not embracing mitigation was he sent a message to those who had more conservative worldviews and were going to find these strictures difficult to deal with. He sent a message to them and said, don't worry about it. Don't fight it. You just go on ahead. And what we find in our data is that these worldview differences, between those who are more incremental and more interested in fundamental change, those who are more cooperative and more competitive, they don't have an impact at the end of November in our last survey among Democrats. They have a giant effect among Republicans. So what, I think this says is the president was just saying, look, I know you don't want to do this. Don't worry about it. And so, people who didn't want to do it just didn't.
Okay, last question then, building on that, Mark, to you. COVID-19, as we know, has had a devastating toll on the United States in terms of loss of life and prolonged illness, but also this enormous economic toll. And as we hit the 1-year mark on COVID, it's clear that we're still going to be in this for some time. But I do want to look ahead and try to take lessons from this period. In public health, we know that this won't be the last crisis and probably won't be the last infectious disease crisis. So what does an understanding of worldview offer the public health field in terms of lessons for going forward? And part of what you just said related to leadership and the importance of voice and leadership. Is that the only lesson, or is there more we should be taking away?
To me, the thing that is most important about what we've learned, is that in all of the work that Jonathan and I have done, is that elite signaling, the positions that our political leaders take are so important. Because right now, because in this worldview dominated political divide, people proved over the last year that they will follow their leaders right off of a cliff. They'll go to the Sturgis motorcycle rally and they'll, tempt fate by, going to restaurants, and they'll do all of those things to own the libs, to do those types of things. Responsible messaging will do a lot, I think, to unwind, that issue. The other thing that I would add is this. It is quite clear right now, and the Biden administration seems to have a sense of it, that people are willing to spend whatever it takes to deal with the economic calamity that the country is facing right now. The only people who don't seem willing to do that are Republicans in Congress. The Republicans in the electorate are just fine with opening up the checkbook to deal with public health crises and to deal with the economic downturn. And that's something that I think is really important for us to keep in mind. There might be some things that leaders just can't tell us we should believe. And this seems to be, to alleviate the economic suffering and so forth, something that I think our leaders on, especially the political left, can be pretty aggressive about.
Mark, Jonathan, thank you both for taking the time to talk with me today about the politics of worldview and COVID-19.
Yeah, thanks for having us.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Hagedor, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.